How did this happen given that clinical trials had already occurred?
Right, right. So there have been six reported cases of blood clots that have happened within a couple of weeks of the vaccine. Probably worth mentioning that it sounds a bit similar to what has been observed with the AstraZeneca vaccine, both of which happen to be adenovirus delivery systems. Keep in mind that these are really rare events. There have been six cases reported in up almost 7 million people receiving vaccines. That rate of event is so low you would not pick it up in a clinical trial. It's the kind of thing that you could only pick up if you're monitoring very carefully all the outcomes in all the doses that you deliver. And so they've obviously deployed the vaccine, almost 7 million times, and so they picked up this kind of rare event.
There are somewhere north of 220,000 people in the state of Arizona who have received the Johnson & Johnson vaccine. What should they be looking out for if they're hearing this news and they're concerned?
Right. What the observation here is in primarily younger women, sort of the 18 to 44-year-old range, something in that ballpark. Uh, and um, and some they get these blood clots, so it's something to look out for in that population. As I mentioned, it's a very rare event. It's probably also important to keep in mind that in that same age group, where there were six reported events nationwide, there were 700 people in Arizona who died from COVID. So the COVID is much more common a killer than the blood clots are.
You and your colleagues at the Biodesign Institute up at ASU have recently discovered a new variant of the coronavirus. How concerned are you?
So yeah, Ephraim Lim and his team have identified a variant that has a mutation in the spike protein that is similar to what's been observed in the South African variant that may allow it to evade some of the vaccine immunity. There have been some data to suggest that even in real world terms, people who get variants like this may still get infected by COVID-19. Now, a couple things to remember though. This particular variant has not been observed frequently. There have only been about 17 or 18 cases to my knowledge so far in Arizona, much less common, far less common than the UK variant, which is becoming more dominant in our state and which does respond well to the vaccines. Also, really important to remember that even if people can get infected with the virus with the vaccine, they still don't have bad outcomes. For the most part, uh, uh, people who've been vaccinated, even with variants that have this mutation, still do not get severe disease or die from it.
What do you make of Arizona's current case rate and the fear that another surge is coming?
So it does look like the numbers are starting to creep up in Arizona. We are starting to see a slow but nonetheless kind of day over day rise in cases. So we do have to keep a very close eye on that. Certainly in other parts of the country, there has been the beginnings of a surge, Michigan in particular, but some parts of the eastern seaboard are also starting to see a rise in case numbers. Probably my biggest concern in Arizona is the growing dominance of the UK variant, the so-called B117 variant, which we do see rising rapidly in Arizona and I think will soon become the dominant strain in our state. And that is a highly transmissible strain. It is also a more lethal strain than the older variant that we had in Arizona. And so we really do have to watch that. And the best advice here is to get out and get vaccinated. And when you're out in public, to wear masks and follow all of the recommendations we've repeated over time about physical distancing and all that stuff.
As people continue to follow all those measures, they want to move on and they would like to know why, in some cases, the vaccine isn't preventing against the virus. So they're at a loss. Where is that balance in achieving the public health, but also slowly starting to return to normal practices? What do you recommend?
So right. So what the vaccine is really good at, and I mean really good at, is preventing severe outcomes. So if you personally have been vaccinated, the risk to you to get a severe outcome is very low. The vaccine does reduce by far the risk of getting the virus, but it doesn't eliminate it entirely. And that's why we recommend mask wearing so that you don't become an unwitting carrier of the virus to somebody else. Now, of course, once we get to that herd immunity, once we get most everybody vaccinated, then we don't have to worry about that so much. And then we will be able to get back to, no mask wearing in public events and going back to restaurants and even going to concerts.
Dr. Joshua LaBaer from ASU Biodesign Institute, thank you for your analysis.
Yeah, thank you. Take care.